Hi, my name is Ken and this is Josh, and we're going to talk about the exercise Y's and T's. So, Y's and T's are for strengthening middle and lower trapezius, and especially if you come to our office, we've actually probably talked to you about that. A lot of patients or athletes have overdeveloped their trapezius, and along with some other muscles they've overdeveloped or are too strong or too tight, or latissimus dorsi, pecs, anterior delts, and subscapularis. Okay? And they're actually pulling the shoulder blades forward and actually elevating them, basically closing off and squeezing the shoulder joint. So we're going to correct that with this exercise. The first one we're going to do is going to be the T's. Okay, so Josh will put his arms out to the sides. Okay? So as you notice, Josh has his toes turned in and his heels slightly out. That's done on purpose because we want to actually internally rotate the femur to actually help line up his hips a little bit better and take some pressure off his back when he actually does this exercise. Now what Josh is going to go ahead and do is because of the compressive forces due to the imbalance that he may potentially have in his upper body, we need to create some space in his shoulders. So he's going to reach for the opposite ends of the walls. Okay. Now he's going to actually externally rotate his arms, thumbs up towards the ceiling. And now he's going to squeeze his glutes. Here's an important part. He's going to lift his head and chest off the floor without moving his arms. And then he will lift his arms up towards the ceiling. And he's going to hold that for 2 seconds. Then he lowers his arms, and then his head and chest. The reason we do it just that way is we want to encourage thoracic extension and scapular retraction and depression first prior to moving the shoulder. Okay? And Josh is going to do that one more time for us. He's going to engage his glutes. Good. The T's are for middle trapezius. Now we're going to talk about lower trapezius. And how we do that is by doing Y. So he simply moves his arms from the T position to the 10 o'clock and 2 o'clock position. And everything is exactly the same. He's going to engage his glutes, lift his head and chest, and then his arms. He's going to hold that for 2 seconds, and then his arms go down, and then his head and chest. Okay? So don't forget to breathe while you're doing this. Okay? If you feel any pain in your thoracic spine, cervical spine, and your shoulders, you need to stop and call us and talk to us about it first. Common mistakes are moving the arms at the same time. You have to actually lift your head and chest and actually elevate your shoulders, your arms, and then trying to do that, and that just compounds the problem. As you can see that he actually lost range of motion when he did